Cec Shevels, and he's the director of Samaritans Foundation. Cec is a social worker who's been involved in the social welfare sector since the early 1970s. He initially worked in disability and youth services in Melbourne and Sydney before joining Samaritans, a Newcastle-based agency, in '91. Whilst the past 2 decades have been a period of growth for the sector, Samaritans have retained its regional focus in the Hunter, Central Coast and Mid-North Coast in New South Wales. Samaritans is a multi-service agency with a considerable involvement in services to people with disability, families and preschool-aged children, young people who are homeless and out of home care. The Samaritans Foundation is the Anglicare agency for for Newcastle Anglican Diocese, and thus it provides services to individuals in the Lower Hunter, Upper Hunter, Central Coast, Manning and the Mid-North Coast regions of New South Wales. Welcome.
Hello. So, as has been mentioned, Samaritans is a Newcastle-based agency, and we've been strong supporters of the shift in disability services to a more person-centred approach and more self-directed services for people with a disability. So we were pleased to have the opportunity to be part of the launch site for the NDIS, the National Disability Insurance Scheme in New South Wales. And at the present time we're already supporting some 180 participants in the scheme, 125 adults and about 50 families with young children. While most of the participants in the scheme we support have transferred from ADIC, the State Disability Agency, 55 of the participants we support are new to us, which means that more people in the Lower Hunter are receiving support than would have been a couple of years ago. As a service provider, Samaritans, the NDIS certainly presents us with challenges, and the government was wise to trial the scheme in various launch sites before rolling it out across the country, so that some of the teething problems could be ironed out. So some of the problems agencies such as Samaritans face include an inadequate pricing structure, which in some areas is causing difficulties for agencies to survive. So in some areas the pricing structure is okay, and in some areas of support it's not okay. So depending on what areas of support your agency delivers could depend on how well you're surviving. The administration of the scheme is quite complex, at the moment more complex than the previous funding model. The move away from block funding, which was the state system, to individual packages has meant there are fewer funds now for staff training and planning and travel between services. And there have been anxieties for support workers with the trend towards an increased casualised workforce, people working uncertain hours and a less obvious career path. But for most of the 180 participants we support, the NDIS has been a positive step forward, and the scheme is opening up new opportunities for them. And after all, they're the people who really matter in this change of approach. So let me share with you some examples of what we've seen in Newcastle of how people have benefited from becoming a member of the scheme. So one example, a year ago, 3 families in Newcastle got together and purchased a home for their children who were all in their 20s. 3 young men, they got on well together, they live together, and they've pooled their individualised packages, and this funds the support hours they need to live in their own home. We met these families through a carer support group, which meets every month at Samaritans premises in Broadmeadows. It's not a Samaritans group, it's just a group who come and share our hospitality and drink our coffee free of charge. There have been significant changes to day programs in the Lower Hunter, especially from ours anyway. Just last week I met someone in one of our offices doing volunteer work there. She used to attend a day program each day of the week. But she comes to this office one day a week, helping out. She wants to learn how to use computers, and that's what she's doing. On other days, she volunteers at a community-based catering service, making sandwiches, because one day she wants to work in a coffee shop. Next year, she wants to improve her budgeting skills so she can live more independently one day. Parents not getting any younger, you hear people say. I'm sure they get that from their parents. This participant is middle-aged, is getting a real buzz out of setting her own agenda in life. Another young woman we support goes out to karaoke on Friday nights until 11 o'clock. Goes out to dinner with her boyfriend each week, and with a support worker if need be, and the two people pool their support dollars. Recently, the parents of this young woman had 2 weeks holiday away from home, and Samaritans supported their daughter to continue living at home during this time. So there's much more flexibility these days under the scheme. Another young man we support goes to swimming training every Thursday night. No longer it's Monday to Friday, 10 to 4. Another goes to football at weekends, whenever the game is on, and was a proud supporter at the Rise for Alex Day at the Knights earlier this year. Another participant, who's quite different, has been assisted to move out of a nursing home into her own rental home. And this is an Aboriginal person, and she's now able to move out of the nursing home and live with her husband and partner and their child. And the scheme has allowed us to provide appropriate staff and the technology to allow this much more dignified and independent lifestyle. And we're currently supporting another young woman who lives in a nursing home with a lot of cooperation from the nursing home, I might add. She goes out in the evening, sometimes comes back after lights out, but she's still welcome. It's good to see organisations working together. At Samaritans, we have a particular interest in families with preschool-aged children. And for these families, we have a team of health professionals who can assist them in those preschool-age years with, if there's difficulty with speech, they need occupational therapy, psychology, early childhood learning. So families don't have to wait for months for an appointment in a clinic or an office. We can get to work with them quite quickly, and services are provided in the family home, in the child care centre, at school, at grandparents' place, wherever is most suitable for the family, so that developmental tasks which are learned can be continued in an ongoing way. We don't focus on the disability, but rather the activity that blocks participation, which is causing them concern. And we do find this integrated approach and the partnership approach with families to be an effective way to work. So despite the difficulties for Samaritans as an agency, we continue to support individualised funding, person-centred services, self-directed services. There are uncertainties about how the sector might look in years to come, and there are challenges for agencies such as ours. And the scheme itself could be improved. I, for one, believe that people, families and individuals with disability can have even more control. Maybe they one day will be engaging the planners themselves, and they could have more control of how their funds are spent. But at the present time, I believe the NDIS does offer a better deal for people with disabilities and their families, and it's the way of the future. Thank you.